Hi, my name is Michelle Dates and I'm coming to you from California. How are you today? I'm the one who reports a lot of vector-borne illnesses and a lot of other diseases that come along with vector-borne illnesses. One of them is possibly what is called interstitial cystitis. A lot of women and men get that today. What is interstitial cystitis? It is actually, and I am not a doctor, and I never claim to be, but I am in that field for many, many years at Cedars-Sinai Hospital, so I do give a lot of education. So let me explain, since I've been doing IC for over 25, 30 years. It's actually when your bladder inside has scarring, blisters. When those blisters are open, they make you burn. So let's say a female goes to the restroom. She has the urgency to go often, and that is a sign. And when she goes, she burns. She can't help but burn. You think it's a bladder infection or a urinary tract infection, and it is not. You have the need to get up. You have the need to, on the freeway, pull over. You have abdominal pain. It is just a very, very feeling of a bladder infection. Men get it as well, but women seem to say they get it often. A lot of people get this with food. You have to watch your food. So let's say when you are diagnosed, and I will tell you what they do for that, urology or GYN urology. What they do is they take you under in the outpatient, they blow up the bladder, they look at it, and they do what's called a hydrodistension. Today's day, not in the day that I was first diagnosed, but today's day, they give you what is called treatments a lot of times. There are bladder washes, and I'm going to show you what that is. The old days, they gave you things like macrobid as an antibiotic. They gave you things like pyridium, which was for burning. A lot of things, and to relax your body as a Valium they gave. They gave Vicodin. They gave a lot of things in those days in the 80s. They even gave Ilavil, is actually an antidepressant. They give you mood elevators because nothing helped the female or the male in that bladder area. And there was really nothing called but urethral syndrome. Then it was changed to IC, interstitial cystitis. When I was diagnosed, I actually worked with a doctor. I'm in California. I worked with a doctor in Loma Linda University, GYN. Very nice doctor, Dr. Jeffrey Hardesty. Him and I worked together many years, and I showed him what I think is best. And him and I worked together, got him reps, and he became an IC doctor. And this is what we did together. But I do other things with other doctors as well. This is called Dmso 50. You use that. You also use which is called Colu-Cortef. You put that in. Different milligrams, 100, 250, depending on your physician. You will also get what's called Heprin. Heprin, 10,000 units. It's actually a blood thinner, but it's good for the bladder wall. The doctors also use lidocaine, Marcaine. These are all canes to bring down inflammation. Once they take all these injectables and they put it in a syringe, they put it into your bladder and you leave it there for 20 minutes. After 20 minutes, you lay on the table. So you turn for 5 minutes on your side, on your back, on your other side, on your stomach. So the full bladder belly is getting that medicine. You avoid and you come back weekly. When you have a flare, most doctors want you to come back weekly for your treatment. And they may give you something on the side. With that, that's what they do. I also, here in California, there's a lot of things you can do. I have a paper that had doctors' phone numbers that I got in the 80s from the Interstitial Cystitis Association. And I also printed out on the internet, which a lot of doctors say to do, so you get to know your body. What is good to eat? You shouldn't have spaghetti. You shouldn't have anything red. You shouldn't have anything acid, coffee, tomatoes, anything that may stir up the flare. Sweets, sugar. Actually, I do a lot with Lyme disease and vector-borne, and it's a lot like that. And a lot of people who have Lyme disease do have interstitial cystitis as well. It just is an autoimmune problem as much as it is Lyme disease. So IC is actually really big. A lot of people do not get the care they should get. There is not a lot of doctors doing this in the California area. There's very limited. I am on YouTube. I know a lot of doctors in Southern California do not know out of the area, and I'm always here to help everyone. So you have a good day wherever you are. It is Michelle Dates coming to you from California. Bye-bye. Take care.